This is a video demonstration of the running subcuticular surgical stitch. You must first mount the needle in the correct position on the tip of the needle driver, a half to 2/3 of the way from the sharp tip of the needle. When you load the needle, you load it at a 45-degree angle from the perpendicular line of the needle driver. When you hold the needle driver, it is customary to place your ring finger and thumb inside the rings of the needle driver. The pointer finger remains straight along the shank and serves as the fulcrum to direct the needle driver when supinating your wrist. If necessary, you can palm the needle driver as shown here. The rings of the needle driver are now placed in your palm, but the pointer finger still stays straight along the shank to direct the needle driver. The forceps are utilized to evert and present the tissue to the tip of the needle, which is driven at a 90-degree angle directly into the tissue. Begin by pushing the tip of the needle deep into the left side of the incision at the distal apex, entering deep in the dermis and exiting superficially right below the epidermis. The first stitch is called your anchor stitch, as it anchors your running line of stitches deep within the incision. Once you have protected your needle, you will tie surgical knots to secure the stitch. Oftentimes, this will be completed with a one-handed square knot, as seen in this video. The number of knots you throw depends on the type of suture. The short end of the suture is cut short without disrupting the knot. You will then reload the needle driver and drive the needle away from you, deep within the dermis at the distal apex of the incision. The needle is directed superficially, exiting directly below the epidermis without puncturing through the skin surface. This will ensure that you are closing the entire incision and beginning your line of suture at the most distal apex of the incision. You will now begin throwing the subcuticular stitches toward the proximal apex of the incision. You evert the skin with your forceps and enter the tissue right at the epidermal-dermal junction, approximately 1 to 2 millimeters deep to the skin surface. You must maintain equal depth and distance between the bites, alternating from left to right side. When entering the tissue, be sure to enter exactly across the incision from where you exited the tissue on the opposing side. You will continue suturing towards yourself until the entire incision is closed. Once you've gotten to the proximal apex of the incision, you will tie surgical knots to secure the line of stitches. In the case of the running subcuticular stitch, this is most often completed with an Aberdeen knot. For the Aberdeen knot, you hold the loop of your last stitch in your right hand and pull the left side of the suture through the loop, dropping the loop as you pull tight. This creates a new loop in your right hand. You pull the left suture through the loop, like so, 3 times. You then pull the entire needle through the loop from left to right in order to lock the stitch. To bury this knot, you drive the needle into the incision line and exit outside the incision line through the skin surface. You then cut the suture flush with the skin surface to completely hide the knot. And finally, always remember to protect the tip of your needle prior to laying it down or passing it off.